Well, startling statistics. We've been telling you that African Americans are disproportionately impacted by COVID-19, and new research says that certain pre-existing conditions may put them at higher risk. Joy Burnett continues our live team coverage tonight.
Well, Nicole, when you hear pre-existing conditions, you may think of diabetes or hypertension and the impact on coronavirus among African Americans, but some experts are saying you should think of something else: where people live. Penna North in West Baltimore is bustling, people coming and going, dozens of communities streaming off buses. For many, this isn't a matter of choice but necessity.
Black Americans are more likely to be these new essential workers.
Dr. Rayshawn Ray, a sociologist at the University of Maryland College Park, said not everyone is able to work from home.
Social distancing becomes a privilege. The whole thought of being 6 feet away, if you're living in a Baltimore housing complex and all of a sudden you have to go to work, you're going to probably pass not only 10 to 20 people, presumably, before you even leave your complex. So what that means is your exposure is high.
Here in Maryland, African Americans make up 30% of the population, but they account for 37% of the coronavirus cases. They're also dying at a higher rate. The dire numbers of galvanized celebrities who performed on a BT special Wednesday night to drive home the severity of the virus. Activist groups like the Baltimore Arabers and the NAACP also broadcasted health tips directly targeting the Black community.
It's very sad and lonely in there.
Sandy Thomas lost both her mother and sister to the virus. They died just days apart in a Baltimore hospital. The CDC is still gathering stats on why COVID-19 is hitting the Black community especially hard, as so many families deal with unexpected tragedy.
My mother and my sister are gone. They were doing everything they were told to do, and yet it still got them.
We have seen testing sites and more medical resources in predominantly African American communities, and Dr. Ray says that's a good thing. It shows that leaders are listening to the problems and shifting resources to where people really need them. Live at 6, Joy Burnett for WJZ.